Welcome back to Sister Circle Live. You know, life can get hectic for all of us, and the constant balancing act can easily take a toll on your health. And no matter how much black girl magic you possess, it still can.
And that's why it's so important to stay on top of your annual screenings. But how do you know which are the right screenings for you? So to help us navigate the medical tests you do and don't need to do is family physician who tells it like it is, Dr. Jen Caudle. Is that right? Welcome to the circle.
Yes.
Good to see you guys.
Good to see you as well. Looking like a whole model.
Like model. I'm trying to get up, y'all.
Doctor's office like this.
I know, right? Just beautiful. All right, Dr. Jen, before we get into which screenings are right for the ladies, which health screenings are right for our men?
Yes, well, so let's talk about that, because men, we love and need our men, and we need them to be healthy. Let's talk about prostate cancer. Let's start with that one. And without giving too much personal information, let me just say that prostate cancer is near and dear to my heart.
Mine too.
Well, and that's not surprising because we know that African Americans actually have a higher risk for prostate cancer. We die more from prostate cancer. This is super important. So this is what I would say, and this is where we ladies need to talk to our men and have good conversations. Men, talk to your doctors if you're between the ages of 55 to 69. That's when we kind of recommend the screenings. But for African Americans, we are high risk. Men need to be screened, or if you have a family history of prostate cancer. So men, please, and don't be afraid to go. It's a blood test. The PSA is a blood test. So a lot of men are like,
well, yeah, because they think of
the digital rectal exam, which sometimes needs to be done, but that's not right. I'll just throw that out for you. Yes. So that's what you're thinking, but it doesn't always need to be done. Often we just start with the blood test. So men, get screened.
Love it.
Okay.
Perfect.
So Dr. Caudle, according to the CDC, African Americans have the highest death rate and shortest survival of any racial and ethnic group for most cancers, including colon cancer. When should you start getting colonoscopies and how often?
I'm going to say 45 years old, okay? So you probably heard of the 50 years old we start colonoscopies, but a couple things changed. Number one, American Cancer Society said average age people should start at 45, but we've been saying for years that African Americans, just like you said, we're at higher risk. We should be screened at 45. So ladies and gentlemen, I'm gonna say 45. And a lot of people are afraid of the test. You heard of people say, I don't want to get a colonoscopy, you're not going to do that, you know, blah, blah. First of all, you're asleep for the test. You know, you don't remember the test. The worst part is drinking the prep beforehand, so people, please don't be afraid of getting that done.
That's real good. Yes. Save a life, obviously.
Absolutely.
Dr. Jen, let's talk a little bit about full body CAT scans. What do you think about getting full body CAT scans for early detection of cancer?
I say no, no, and no.
Really?
Yes. No. No, and no. Why? And this is why. So full body CAT scans, it's the idea of scanning your whole body, not knowing what you're looking for to scanning. The problem with these tests is you can have what's called false positives, meaning the test shows something, but that something may be nothing. And you may go through undue tests and may be afraid and worried. Anyway, these tests can actually do more harm than good because they're not specific. No full body, no. You don't need to do that. Just do the other ones we talking about.
Okay. You're absolutely, you're absolutely right because you're a doctor. You know what you're talking about. But actually, I went through that.
Did you?
Where I had an MRI. And it said that I had an aneurysm, a brain aneurysm. And I was stressed for 4 months until I went back and had a CAT scan, and they were like, no, you don't have one. Now, look at God. But still, these tests they're inconclusive, and it's
you don't want to play around with them. You want to get what you need. Absolutely.
That happened to me in real life.
I'm so sorry to hear that. It's tough.
Do you think maybe some of the stress of those tests that give you the wrong answers, do you think that can even bring on an onset of some kind of, you know, the stress levels? Can it even bring on something, an ailment?
I always believe that how we feel up here affects how our body reacts. If you are stressed, I believe that your body will manifest it in some ways. So yes, stress is no good. Absolutely.
And you recommend
hepatitis C. Yeah, and I know a lot of people are not familiar with this. Baby boomers. These are my baby boomers. So 1945 to 1965. If your birthday falls in there, I want you to get screened. Just a blood test, because those people actually have a higher incidence of hepatitis C. So if your doctor hasn't talked to you about it, ask your doctor about it. Absolutely.
Well, Dr. Jen, what health screenings do you recommend for women that it's a must-have? Go and do it today.
Your mammograms, your PAPs, make sure you get your colon cancer screenings, get your blood pressure, your cholesterol, all these things checked. And can I just say one thing? Let me just tell you. And I love my family and I love my people, but I know that sometimes we don't talk about stuff. Sometimes we don't talk about our family histories and what grandma had and auntie had and sissy had. We got to know our family history because knowing what you had in your family will guide what tests you need. So find that stuff
That's why they ask all that.
That's what we ask. So ask your granny, ask your cousins, ask your uncles, and we got to talk as a group of people. We got to talk to each other.
One last question.
Yes, ma'am.
Are you taking any new patients? I'm really looking for a family physician. I don't have a regular.
For you anytime.
Do you take I take all insurance. Dr. Jen, thank you so much for joining us today. To keep up with Dr. Jen, visit her website, drjencaudle.com. Up next, we're sharing our Monday motivation and our full circle discussion. Stay with us.
Yay.